So right now we're going to talk about mental illnesses. And different types of mental illnesses and disorders. So I'd like for you to just think for a second. What do you know right now about mental illness? And do you think that people that are have either a diagnosed or an undiagnosed mental illness are they treated well in our society? I'd like you to pause and just think on this for a second or two. So I think that the answer is like most things. It depends. I think that if you have a personal relative with somebody that has some kind of a mental illness, you will automatically have a little bit more sympathy, a little bit more empathy for that person because they're family and you know where they come from and what they represent and the kind of the good in them, even if maybe it's difficult for them to show it all the time. It just depends on the type of mental illness that we're talking about. I think that if you come across a random person on the street that has a very clear mental illness, it might be a little bit more difficult for some people to find the empathy for that person as well. And I do think that it's super important that we treat mental illness, mentally ill people, because it's certainly not something that they chose to deal with. And some people that are mentally ill can be, fixed and just like have a totally normal place in society as long as the right treatment and medication is given to them. So if we can help them, it might help everyone, right? So I do think it's important to do that myself. I'd like for you to write this down. A medical condition, this is in your notes, a mental illness is also called a mental disorder. So write down both those definitions, both of those words in bold, please. It's a medical condition in which a person's mental or emotional problems are so severe that they interfere with daily living. So where it says examples of mental illness, you can write down these two, anxiety and depression. I think all of us feel anxious from time to time. We all feel depressed from time to time. But if it interferes with your daily living and it's diagnosed by a doctor, that's what we're talking about with a mental illness or a mental disorder. So let's talk a little bit about anxiety. Anxiety is really common. It comes from that word anxious, right? It's an extreme fear of real or imaginary situations that get in the way of normal activities. So it's almost like being regretting the future that hasn't happened yet. That's a good way, I think, to think about it, right? You're already saying like, oh, I'm already going to mess this up. It's going to be so bad. I mean, you don't know what's going to be bad, but it's not like a rational thought that's going in your mind at this moment. You're getting worried about something that could or may not come to pass. So symptoms of anxiety, you can have an increased heart rate, rapid breathing, sweaty palms, sometimes you get an upset stomach. I know me when I was a kid, I sometimes would get like these really stomach aches. So I was really worried about something else. I almost like wanted to get myself sick to get out of something, and then I would almost felt like I willed on the stomach ache, and that almost like got me out of something, which wasn't the healthiest coping mechanism. Now that I look back on seeing what it is. So if you're experiencing these symptoms on a regular basis, it's possible you have an anxiety disorder. But if you're just like if there's a big concert performance coming up, a big test, it's normal to be nervous about that. That's different than having anxiety. So, different examples of anxiety. There's a panic disorder, which would cause panic attacks or these episodes of intense fear. You can calm yourself down and learn how to deal with panic attacks if you see like a psychiatrist. There's generalized anxiety disorder, which is extreme or unrealistic worries about daily experiences. There's all sorts of phobias, right, which is like irrational fears about something. I'm sure you've seen examples of that. There's obsessive compulsive disorder, which is obsessing over certain thoughts and behaviors. Like there's often a lot of repetition dealing with that, or a lot of cleaning. Some people will like drive somewhere and then have to drive back to the house, make sure they locked all the doors, double check everything before they go. And then there's PTSD, which is dealing with a traumatic experience and kind of reliving that experience over and over again. All of these are under the bracket category of anxiety, and all of these things are something that you could write down. And then there's depression. Depression is a feeling of hopelessness, loneliness, and the inability to care about anything. So most people do experience depression at some point in their lives. If you have a close loved one that passed away or just something really negative happened in your life, it's normal to feel depressed or kind of what people say sad at the time. But if you're getting diagnosed with depression, major depression, clinical depression, it's not so much that you're just always feeling sad. It's often like a lack of feeling at all. It's just a disconnected, a not feeling much of anything. So again, don't diagnose yourself with depression. If you feel like you have some depressive symptoms and it's ongoing, this is the time to talk to a doctor. All right, so I'm talking about a very difficult topic right now. which is other types of, these are all classified under mental illnesses or disorders, and they're all having to do with self-injury or self-harm. So you're going to want to write down these examples. Specifically, you're going to want to write down the first two examples of eating disorders. So there's anorexia is a type of eating disorder where people basically starve themselves very slowly. They will have much less food than they should normally, what's a healthy amount. And it's not just that, it has a lot to do with your self-image and seeing yourself in the mirror and being constantly obsessed with the weight that you see. Oftentimes people that are already clinically underweight will look at themselves and they'll still view themselves as being overweight. And it's just a warped sense of self-image that they're not seeing themselves correctly. And that's why they engage in this kind of like, it's almost a strategic starvation of sorts, which would be anorexia. Bulimia is a little bit different because whereas an anorexic person might, some warning signs might be that they don't want to eat meals with anybody. You'll never actually see them eat. They may have excuses to get out of it, or they might make a really big deal about like a small meal that they're eating being like, oh, I'm so full from before, but you'll never actually see them eating. Bulimia will eat, but afterwards, what they tend to do is they will basically force themselves to throw the food back up, to regurgitate it back out. And in that sense, they're not holding on to the calories. Of course, they're not getting any of the nutrients from the food too. And so both of these are so dangerous. Not to mention, but the stomach acids that are coming up through the esophagus. Of course, it's not a big deal if you throw up every once in a while. It's kind of your body's way of getting rid of something, right? But if you're doing this every single day or regularly, that stomach acid is going to burn parts of your esophagus and it can cause some long-term damage. And then binge eating disorder factors in with this, where maybe people go a long stretch without eating, and then they'll eat way too much, and it's just not the healthiest way to deal with food. You don't want to always like go all or nothing. You want to have short meals that are spread throughout the day, as we talked about in the nutrition unit. So other types of self-injury will be just addiction to substances or activities. You're putting that stuff in your body because you're having some kind of an addiction to it. And then the last one is self-injury, which could be something like self-mutilation, which is like cutting oneself. And you might think, why in the world would somebody want to do that? And that should be a good thought in your head. You're right. I mean, it's hard for me to imagine why somebody wants to. I have read about it. And from what I've read so far, the justification they've used is that basically real life, through the mental illness that they're experiencing, was just so devastating, so difficult, that it was the only sense of control that they had was to, cause some harm on themselves. And a warning sign could be if it's summertime and you see people with like long sleeve shirts that are covering up potential scars that they had, right? That is a possibility, right? That there's a reason for something like that. Not always. It's just one of the warning signs here. So it is a very serious thing. People have checked themselves in and gotten help from it. But if you have any suspicion that somebody that you know of, or if you are thinking of any thoughts like this, you got to talk to somebody to get help, because people get help from this type of thing all the time. People can get better. So is it a myth or a fact that eating disorders and self-injury are not real disorders, but just a way for people to get attention? That is, of course, a myth. Eating disorders are serious mental illnesses, and self-injury can be addictive to people, and it can be connected to other serious mental illnesses. So why do people actually commit suicide? And this is something you're going to want to write down too. So people consider suicide because they just believe that their life can't actually get better. And a mental illness like depression can often be the cause of something like this. So one of the most heartbreaking thing about reports from people that have tried to commit suicide was there was this documentary I saw. It was all about people jumping off of a bridge, and they interviewed the survivors from it. And every single one of them basically said the same thing. As soon as they jumped, it's like this light bulb went off in their head and they immediately regretted it. Not a single person was like happy with their decision afterwards and wanted to go through it. It's like they just woke up from whatever it was. Maybe the adrenaline kicked in. I'm not too sure. But it just goes to show you that at that moment, it seems like is when their brain was thinking most clearly. And before that is when they were not, because that was when the mental illness was taking over. So we really want to help people and find out what are some of these risk factors for people that might go and commit suicide. So if they have committed suicide or they have tried to commit suicide in the past, that is, of course, an indicator that they might in the future. history of mental illness or substance abuse, if there's trouble at home. Sometimes a crisis like a financial hardship suddenly, or abuse, neglect, bullying could trigger something that's already underlying in someone. Also, apparently, hearing about suicide has increased. There's something called like a suicide contagion or suicide cluster, in which other people hear about this and then they copy the behavior, which is obviously a really scary trend to think about. So, is that a myth or a fact? Yes, it is a fact that hearing about it can actually cause people to kind of copy that. And then we have to think about, well, what's the impact? Who's left over that has to deal with it? So the survivors, right, the people that are close to somebody that has lost somebody to suicide may feel guilty about not being able to stop it, or just feel abandoned or rejected, embarrassed or ashamed that they have to deal with that stigma forever. And since other people that don't really understand, they don't like, it's hard to know what to say. They may not say anything, and then because they're not getting, because they're so uncomfortable with it, they may not get the help that they need. So, what are two ways to get help? This is what you're going to want to write down in your notes. Two ways to get help are the first two on here: therapy, right? Whether it's individual therapy, family therapy, support groups, and medication. So those two things, therapy and medication combined, tend to be the best way for mental health. It's fine to only use the medication as long as your doctor or your therapist is saying you no longer need to go in. Some people have one or the other, but both together seem to be the best way. And then if it's more severe, it could be an inpatient treatment with round the clock care.